It's another day, the sun is shining. Got to know what's going on around you. Wake up, it's the time to motivate your mind. Come with me, let's make this moment brighter. Wake up with the Bahamas at sunrise. Come on and wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Hey.
Good morning and welcome to Bahamas. A happy Monday to you. I'm Anastasia Palacios.
And I am Mark Daniels. Thank you for joining us dead early on this marvelous Monday here on Bahamas at Sunrise.
And of course, it's always our pleasure to be in your company, to be able to bring another great show to you. We hope you had a wonderful weekend. Some interesting weather for the most part, absolutely beautiful. And then in the West here, Mark, we did have some serious storms as well early yesterday morning. So a mixed bag over the weekend, but certainly a very good one. How was yours, Mark?
Pretty relaxed. We got some rain up here in Eastern New Providence as well. I took the opportunity to fertilize my fruit trees because now that we are entering in the rainy season, hurricane season, it's good to fertilize your trees now as the fruit begins to set so that you ensure that it gets all the way out to completion. So you can find yourself a typical basic fertilizer, organic or not, depends on your flavor. But go ahead and fertilize those trees and get ready to plant stuff in June. It's a great month for planting all those summer crops you like.
Awesome. I love having the botanist on the show. My daughter has been enjoying some cocoa plums, plums that we planted and goes to look for them every day to see whether or not she has any more on the tree. So it really is a fun activity for those interested in the outside. I'm more of an indoor girl myself, but she gets lots of fun planting and being in the garden with her dad. And so I encourage you to follow Mark's advice. He, of course, is the top botanist in the nation. And so whatever he says when it comes to plants is gospel. Well, we've got another great show lined up, Mark. I'm really excited because May is Better Speech and Hearing Month. And we're going to be talking with Krista Major. She's a speech and language pathologist out of Doctors Hospital Systems. And it's really important. So many parents wonder, why their kids may be delayed with certain things. And I just want to remind parents that now is the time to make sure that you're getting your kids tested, that you're giving them every opportunity to succeed. When we decide to not allow our kids to fully express themselves by getting these tests done, understanding whether or not they're differently abled, we're really not giving them the best options to grow and develop. So that's going to be a great conversation with Krista. And then Dr. Pinto is back for another urology care segment. And we always know it's always fun when Dr. Pinto is in the house.
Dr. Pinto is a regular and we love him on our show. We're also going to have Fidelity on the show this morning and they're going to be telling us about their merchant services. And we'll also talk about Mental Health Awareness Month with Nyambi Hall Campbell Dean, PhD at the University of the Bahamas, and Jewel Horton. But let's check in on weather with Brother Godfrey Burnside. I think we got some more rain this week. Get your rain boots.
Weather at Sunrise, brought to you by Bahamas First. What's first for you comes first for us.
Thank you, Mark, and good morning, Bahamas. And yes, Mark, there's some more rain in the forecast. Deep tropical moisture, coupled with a developing mid-level disturbance and the favorable upper-level conditions, will cater to a wet pattern over the next couple of days across the islands. Today, cloudy, warm, and humid, with scattered showers and likely thunderstorms. Some of those showers becoming heavier at times, those thunderstorms severe at times. High temperature gain 7 degrees Fahrenheit. Tonight, mostly cloudy skies, again with a few scattered showers, likely thunderstorms. Going down to 75 degrees Fahrenheit. And some regional highs and lows across the Caribbean, Barbados 88 and 78. In Jamaica, 89 and 76. In Trinidad, 87 and 78. And the Turks and Caicos Islands, 87 and 73. Across North America, Atlanta 86 and 65. In Raleigh, 88 and 66. In Miami, 88 and 76. Dallas, Texas, 90 and 74. And Toronto, Canada, 70 and 56. As you go the week, mid to upper levels weather feature will persist, allowing bouts of severe weather across the islands to linger through the week. So therefore, the most part, to be looking at mostly cloudy skies with a few scattered showers, isolated thunderstorms most of the week. So temperature daytime will be in the mid to upper 80s at daytime and the mid 70s at nighttime. That was wrapping your first look at weather at sunrise. I'm Dr. Burnside. Back to you, sir.
Thank you, Godfrey. Well, each May Better Hearing and Speech Month provides an opportunity to raise awareness about communication disorders and available treatment options that can improve the quality of life for those who are experiencing problems speaking or hearing. Here to tell us more about it, I'm so happy to welcome one of my very best friends in the world to get to show off her brilliance and to let you know how you can help those in your life that might need her services. Miss Krista Major, she's a speech and language pathologist with Doctors Hospital Health Services. Miss Major, good morning and welcome to Bahamas at Sunrise.
Good morning.
Always a pleasure to have you with us. I think you've been with us once before. And so it's really good to be able to talk about this because there are some people who may see things happening, whether it's with their children or with their elderly loved ones and not know exactly, what to do or how to go about solving the situation. So let's get started by first understanding what is speech language pathology and what is the role of a speech language pathologist?
So a speech and language pathologist is also known as an SLP. And you may typically hear the word speech therapist. So they all fall under the same umbrella. We all do the same thing. It's just different terms. So what we do is we evaluate, we diagnose, and we treat speech and language disorders. So what that really means is whether a person has a problem or difficulty producing sound, unable to be able to communicate their wants and needs, we come in and we facilitate that. So we diagnose and we treat once a disorder is established. We go from there. Also, swallowing disorders fall under that. So we also work with persons who might have had strokes. Difficulty swallowing sometimes is impacted by such a disorder.
Okay. So I'm glad that you mentioned the fact that swallowing is a thing. I remember as my grandmother, near the end of her life, that did become an issue for her ability to just swallow food. And it's so important for people to recognize they can have help from these areas. What are some of the other speech and language impairments that you would see in your field?
So normally we would see a lot of patients that have fluency disorders. So what that is, that falls under stuttering. So it can be a child, it can be an adult that have difficulties producing clear speech, intelligible speech. So that would fall under fluency. Something else would be articulation. A child or adult may have difficulty producing a particular sound. So they would also need treatment for that as well. There are persons, like I mentioned before, that had strokes. So it's not only swallowing, but they might have difficulties communicating, the loss of speech. So depending on the area that their stroke damaged, they might have difficulties being able to have those conversations like they used to, or communicate with loved ones like they used to, or even just say their name. So that's another area that would definitely we would address.
And do you work with, I know, very recently we came out of Autism Month, and is there any sort of connection between maybe some sorts of children with autism and their ability to speak? Would you work with those types of people as well?
Yes, we do have a lot of patients that we see with autism. So they're on the spectrum. And with that, we do work with little toddlers. Nowadays, a lot of kids are being diagnosed really early. So we're no longer waiting for 5 or 6 years old to say, oh, my child has a problem. So we might see that the child has delays early on. Once they're diagnosed, we do notice that early intervention do assist with that. And that's where we step in. So yes, we do work very closely with children on the spectrum population.
Yeah, I'm happy you mentioned that because early diagnosis in most of these instances is one of the best cures, right? A stroke often happens later in life, and so you're working to come back to something. But if we could start our kids out on the right path, then they have a much better lifestyle ahead of them. And so it's really good that you mentioned it. How can speech, or how is speech and hearing impairments treated and or prevented? So you say, like, you work with people who might be having trouble articulating things. I don't know if many of us can comprehend what that looks like. So can you let us know how you kind of do that?
Okay, so like I mentioned before, what we do is we start by diagnosing whether the child or adult may have a speech impediment or a speech disorder. So once that diagnosis has been established, then we move on into diagnosing their disorder and starting treatment. So what that would look like is for example, if they have a hearing impairment and they have had an assistive device, so let's say they have hearing aids, we now work on what areas of speech is delayed or have been affected. So for example, they might have difficulties producing voiceless sounds. So for example, they might not be able to make the F sound. That's very difficult sound because you don't really hear it. So when your hearing is lost and you now have this new device that's assisting you with your hearing, you're now having to kind of learn how that sound is formed. So just going through the mechanics of that, teaching and training how to use our mouth, our what we call this like our oral structure. So how do we use our tongue, our lips, and our teeth to produce these sounds? And with that, it's just like I said, training and showing how to use the mechanics.
Okay. And what is listening and spoken language therapy, and how does it help patients?
So that is a set of strategies and principles that we use to teach babies and young children with hearing loss. Spoken language through listening is very popular. So when a child is diagnosed with a hearing loss and has a hearing device, so they have a hearing aid, sounds can go directly to their brain. So what that is, this is done with not only the help of a speech pathologist, but also assisted by an audiologist. Most often a pediatric audiologist. So kind of working hand in hand on working on how to kind of treat the child and to teach them how to hear these sounds. The device assists obviously a lot with that.
Okay. So you mentioned working with an audiologist. Is there another group of people, or who are some of the people that you would work with? And what is the benefit of doing so in addition to the audiologist? Because I imagine there are teams of people needed in order to see patients, in order to see this stuff, allow them to speak again, especially in issues where they lose their ability to do so.
So we work closely with school counselors, with school psychologists as well. Like I mentioned, the audiologists, and also the pediatric population. So that would be like the pediatricians, all of the physicians that might have worked with that child or that adult, whether they had a hearing loss, whether they've had some form of issues with like their cleft and lip palate, whatever surgical needs that they would have had in the past, we would communicate with their doctor in terms of that and go from there to kind of start the process of the evaluation and diagnosing of the disorders.
Okay. And, you are part of a team of Doctors Hospital Health Services. And of course, you mentioned some of the other people. Some might be external, like school counselors or even maybe school or child psychiatrists. But in terms of the Doctors Hospital Health Services rehabilitation team, what other sorts of rehabilitation services do you provide in addition to speech pathology?
So at Doctors Hospital, we have a physical therapist. We have occupational therapists here at the hospital. So we have a team, a rehabilitation team that we provide these services here. And we're located right down from the hospital. So on Collins Avenue, opposite Kelso. So it's really close in case a patient is in the hospital and we need to have services provided for that patient in hospital. We do that as well. along with our outpatient services.
Excellent, excellent. And then finally, how can we reach you? I know you mentioned you're right up the road from Doctor's Hospital, but is there a number that we should call, or how do we get in contact with you or someone from your team?
Yes, so our number here is 302-4636. And like I mentioned, we are located down from the hospital, Doctor's Hospital, opposite Kelso Lab. We also have new locations as well. We have the Cable Beach location, which is in the Cable Beach Plaza next to Wendy's. We also have our new location, which is located on Carmichael Road. It's in the plaza next to Popeyes, if you're familiar with that. Also in that same plaza is Cash and Go. So those are our 3 main locations here on Nassau. And we're open Monday through Friday, 8 a.m. to 5 p.m.
Excellent. All right. Well, Ms. Major, thank you so much for joining us this morning on Bahamas at Sunrise. Krista Major, of course, is a speech and language pathologist with Doctors Hospital Health Services. And I hope that our audience is that much more aware of the types of things that can be done. I think so many times, unfortunately, with health, Krista, we imagine that if a problem exists, that there's nothing that can be done about it. But this was a great way to learn that we can do some things in order to make sure both our speaking and hearing is not as impaired as it is. And so we thank you so much for joining us this morning on Bahamas at Sunrise.
Thank you so much for having me.
You're watching Bahamas at Sunrise. We'll be right back.
Our world has changed. Many businesses have been closed for months with little or no access to their customers until now. Rev Media can help you remain connected to your customers. Our trusted customized advertising packages and personalized consultants will provide your business with immeasurable support during this challenging time. Your customers are already watching. Rev Media can help you to remain connected. Call us today. Let us help you.
With so much going on in the world today, only accepting cash at your business can be risky. Let Fidelity offer you and your customers safety, convenience, and the flexibility of a fixed or mobile terminal. Take it with you, on the move and on the go, because business should never stop. For more details, speak to one of our business development officers at 356-7764 in Nassau or 352-6676 in Freeport. Visit our website at fidelitygroup.com or visit us at any of our branches.
Welcome back. Now, cutting back on sleep, even for a little while, may have a dramatic effect on men's testosterone levels. Yes, lack of sleep may equal a low testosterone level. Here to help us understand how the two are related is Dr. Gregory Pinto, urologist at Urology Care Bahamas. Good morning and welcome back to Bahamas at Sunrise, Dr. Pinto.
It's my pleasure to be here. I have to say, as always, good morning to my daughter, Gia. Yeah, so June is almost upon us. June is Men's Health Month. So we're going to highlight a lot of issues related to men. A lot of men don't even realize that testosterone exists. They don't understand what it is. They don't understand what it does, the importance of it. But they unfortunately have the ill health effects, and it negatively impacts their life because they have low testosterone. There are too many men in this country who have, because of obesity, they have a link to something called obstructive sleep apnea, where women will know this, their partners will know this. Many men don't realize it, but they're snoring and the whole house is vibrating. They stop snoring and they stop breathing for a few seconds. That's one of the signs of obstructive sleep apnea. So when you have obstructive sleep apnea, you're almost certainly going to have low testosterone. Wow. Testosterone is a hormone that is extremely important for making men men. It gives them vitality, gives them that sexual libido, gives them that ability to keep an erection, maintain an erection. It's also important for keeping on your lean muscle mass, preventing you from putting on weight very easily. It gives you that endurance, that stamina. If you have low testosterone, you can have what you call andropause. You can basically be in the male version of menopause, where you can be prone to heat intolerance, hot flashes at night.
Wow. Hold on.
Yeah.
Hold on. This is a lot. Hold on. Now, let's go back a bit. So if I am having disruptions in my sleep at night, that can translate into low testosterone levels, which could be the reason why you're actually feeling tired during the day and dragging. And it's not always just the fact that you lack sleep, it's the results of not getting enough sleep. And in this case, it's your testosterone levels fall, right?
Well, we can put it in layman's terms in terms of it's not just the hours of sleep. It's not the quantity of sleep. It's look at the quality of sleep. So sleep is divided into REM sleep, non-REM sleep, rapid eye movement sleep, non-rapid eye movement sleep. REM sleep is when you dream. It's also a very important part of the sleep pattern where the testosterone that you use up throughout the day is replenished so that you don't feel fatigued the next day because the testosterone you used the day before has been replenished. But if you can sleep 10 hours and you don't have sufficient REM sleep, you're going to feel fatigued all the time. Your testosterone is going to fall every single night. Not only that, when you have low testosterone, your obstructive sleep apnea gets worse. It's a vicious cycle. So if you have obstructive sleep apnea as a male, you're almost certainly going to have low testosterone. If you have low testosterone, you're almost certainly going to have obstructive sleep apnea.
So right now, my current situation is my wife and I, we have 2 newborn twins, right? And I am not getting a full night's sleep. And throughout the day, I've been feeling foggy, been feeling a little groggy. But I figure that's just a part of parenthood. So could it be that my testosterone levels are dropping because my sleep is getting broken up at night?
It very well can be. So I always advise men, at least at the age of 40, to get at least a baseline of testosterone, because your testosterone level is going to fall at least 1% to 2% every year starting at the age of 40. Some men have always been on borderline normal or very low, or just on the low side of testosterone. If at the age of 40, every year they're dropping their testosterone, they're just going to feel the ill health effects of low testosterone. So there are too many obese men in this country. Obesity has a strong correlation with obstructive sleep apnea. Obstructive sleep apnea is strongly correlated with low testosterone. So it's all interrelated, unfortunately. So if you can lose that extra weight, you can get your testosterone up to normal. You can get a better night's sleep. You'll feel more energetic. You'll have those better erections. You'll have a more positive attitude in life. You won't be prone to depression or irritability. So when you have low testosterone, you can basically put on 40, 50 pounds, put on that bear belly. You don't even necessarily drink beer. You can feel 20 years older than you actually are. So it's all interrelated. And first thing we need to do is look at the root cause. It might be because of obesity, it might be because of low testosterone, it might be because of a condition called metabolic syndrome, which is related to obesity and low testosterone and the possible late onset and middle age of hypertension, diabetes, and hypercholesterolemia. So
Dr. Pinto, tell us.
Yes.
Just tell us. So we're hearing about the different ways that you're interrupting your sleep and obesity can impact your low testosterone levels. How do we raise them? You know, you see these commercials on TV where they say, oh, take your testosterone supplement, and you see the guys are all muscly and looking good. Is it really that simple, or are there natural ways to increase your testosterone level?
Well, firstly, we have to figure out what is the type of low testosterone. There's primary and secondary. But for the most cases, it's related to obesity, obstructive sleep apnea, or it may be related to an advancing age. So you can have low testosterone, late onset hypogonadism is what it's called as you advance in age. So middle-aged men need to be aware of them having low testosterone. It's not as simple as just taking something that's in many cases a marketing gimmick. You have to treat in urology and modern medicine. I always try to speak about this, treat the root cause. There's no point treating the symptom. There's no point trying to give you testosterone and you're not trying to treat the cause of why your testosterone is always falling. Right. You're just fighting a losing battle, because you may feel better for a little while because we're giving you testosterone, but if it's always going to fall, we're not really getting anywhere. So we need to figure out what is the cause of your testosterone falling. In many cases, it's related for men in this country because obesity is so prevalent. It's related to the obesity itself, it's related to metabolic syndrome, and it's related to obstructive sleep apnea.
Wow. Tell us, there's the term nocturia. Tell us, how does this affect the situation?
So on top of all of these things that causing men as they get older, 40 or older, and 40 is not old, it's still relatively young, but I'm talking about, yes. So middle age, we're going to 40s, the 50s, the 60s, every man's going to have an enlargement of their prostate. And I'm not talking about prostate cancer. I'm talking about benign, non-cancerous enlargement of your prostate, BPH. Because of that, you're not going to be able to empty your bladder completely. You're going to have a weaker urinary stream. You're going to pee more urgently, more frequently. You're going to wake up a lot more times in the night to urinate. And because of that, many men, they might be 50 years old, they might be 60 years old, might be 75 years old, but they're waking up 5, 6 times in the night to urinate, even though they may stop drinking at 6 o'clock in the evening, which in itself can cause a lot of ill health effects because they're going to sleep dehydrated, because they know if they even have one glass of water an hour, 2 hours before they go to bed, they're going to be waking up 5, 6 times in the night. And not only that, it affects their marital life, because how are you going to wake up 5, 6 times in the night and not wake up your wife at least half those times, if not every time? So even your wife is walking around like a zombie. So when you get middle age, unfortunately, a lot of things happen. Yeah. Low testosterone, obstructive sleep apnea, nocturia, waking up in the night to urinate. We can give you medication to stop you waking up to pee all the time. We can do, if that even fails, we can do minimally invasive outpatient procedures to reduce the size of your prostate. You don't have to wake up at all in the night to urinate. So listen to your body. If you're not getting a good night's sleep, if you're not getting that quality night's sleep, if you're falling asleep at the drop of the hat, if you have to drink coffee all day just to survive, if you're falling asleep when you're watching TV, the TV is watching you, you know that something is wrong. If you don't have that energy level, that gusto, something can be done about it. And there's usually a root cause that we can treat.
Definitely wise words from Dr. Pinto. Always a joy having you on the show. I always learn so much, especially about men's health and the things that we should be aware of as we age and progress towards middle age. You know, nobody's getting old, middle age, right? So I'd like to thank you again for coming on this morning, Dr. Pinto.
My
talking
pleasure.
About low testosterone and how a good night's sleep can do more than just make you look pretty in the morning. So I'd like to thank you for coming on again, Dr. Pinto, and talking with us on Bahamas at Sunrise.
My pleasure. Thank you for having me.
You're watching Bahamas at Sunrise. If you want to find Dr. Pinto, you can find him at Urology Care Bahamas. We'll be right back.
In the Bahamas, small business is big business. More than 90% of the businesses in the Bahamas are classified as micro, small, or medium-sized enterprises, or MSMEs. The Access Accelerator Small Business Development Center was created to serve them. We at the Access Accelerator offer a variety of services to our clients: business advisory services, training and entrepreneurial programming, mentorship and incubation, and advocacy.
Join the Click is an initiative started by Cable Bahamas Business Solutions last year when we were trying to figure out how to help business leaders as well as consumers to stay connected. Working with Canoe, working with other partners, working with the government and My Gateway to help them to connect with customers who want to place orders and want to be able to do things in a digital way.
My Gateway. My Gateway is a groundbreaking portal through which clients can request and pay for government services online. We have 28 services. We expect to increase the number of services to a minimum of 200.
I love that we're helping the government and helping our citizens to be more efficient and to use their time more wisely.
I invite you to sign up for mygateway.gov.bs and let us make government work for you. Join the Click.
Welcome back to Bahamas at Sunrise. We're at the halfway point on this marvelous Monday. I'm Anastasia Palacios.
And I'm Mark Daniels. Thank you for joining us dead early on Bahamas at Sunrise.
Indeed. We hope that you've had a great morning so far. Always great conversations with our medical professionals, Mark, both hearing from Dr. Pinto and from speech pathologist Krista Major, just on some things that we hope you guys get to listen to, but not just listen to on the show, but take action on so that your lives are improved.
Yeah, definitely learned a lot from Dr. Pinto. It's always great talking to him, especially about men's health, removing the stigma from us men on really knowing what's going on with our body. And love that Krista with that segment with Krista, speaking about the children and being able to diagnose your children properly. It made me think though, I hope that a part of the speech and language pathology treatment, in the Bahamas, we switch up our W's and our V's, right? So Vichin, V vent to the vet non Vansdy, right? And I wore a violet dress, right? Or they wore a violet dress. So that, you don't got to treat that. Keep that in there. I love our Bahamian colloquialism. And if our children switching up their W's and the V's, I endorse that. Vichin. Yeah.
I will, I didn't get to ask her that one, Mark, but that's a very good question. Since she is a personal friend, I'm gonna check on that word for you. You'd be so proud of my mom, who does that all the time. And
Yes.
And yet she's so articulate, right? She really speaks the Queen's English incredibly well. And so whenever she's very, very, it really is said articulately. Well, listen, we've got more to come in the second half of our show. Jermaine Wilkinson will be telling us about Fidelity's click and pay terminals.
And we're also going to be talking about how to raise awareness about mental health issues. But let's take a second look at weather with Brother Godfrey Burnside.
Weather at Sunrise, brought to you by Bahamas First. What's first for you comes first for us.
Thank you, everyone, Bahamas. In your second look at weather sunrise, we take a look at the tropics. In the tropics this morning, we do have a large and complex area of low pressure that's expected to develop across Central America, the Yucatan Peninsula, and the southwest Gulf of Mexico in a few days, partially related to the remnants of Hurricane Agatha from the eastern Pacific. This system has a low or 30% chance of tropical cyclone formation through the next 5 days. The official start of the 2022 hurricane season commences on June 1st, and the public is encouraged to keep abreast of the information regarding this particular system from the Department of Meteorology and to continue preparation before the start of what is anticipated to be an active hurricane season. On the local scene, deep tropical moisture coupled with a developing mid-level disturbance and favorable upper-level conditions will cater to a wet weather pattern across the island. In the marine forecast today, those winds east to southeast at 10 to 15 knots, 3 to 4 feet over the northwest and central Bahamas, east to the 15 knots, 3 to 5 feet over the southeastern islands, which will possibly be wet. You can have some gusty winds and high seas, local as heavy showers and thunderstorms. On Tuesday and Wednesday, those winds northeasterly at 10 to 15 knots, 3 to 4 feet over the northwest and central Bahamas, at 15 knots, 3 to 5 feet over the southeastern islands. In the north and the southeastern islands, those winds could be falling light and variable at times. Your tides. You can expect a high tide at 8:31 this morning. Next low tide will be at 2:32 this afternoon. High gain tonight at 8:55. Sunset 7:54 this evening. Rising at 6:19. UV index 8. Your water temperature 77 degrees Fahrenheit. And the moon phase. Moon. Your extended look. That mid to upper level weather feature will persist, allowing bouts of severe weather conditions to linger across the islands through the week. For the most part, we're looking at mostly cloudy skies, still warm, still humid, with a few scattered showers likely thunderstorms, and low temperature daytime will be in the mid to upper east at daytime and the mid-70s at nighttime. If that's what tracking your phone, look at weather at sunrise. I am Godfrey Burnside. Back to you, Mark.
Thank you, Godfrey. Are you a business owner who is currently looking for a merchant services provider? Well, look no further. Jermaine Milkinson, Merchant Services Representative with Fidelity Bahamas, is here to tell us more about Fidelity's merchant services. Good morning and welcome to Bahamas at Sunrise.
Morning, sir. How are you?
I am doing well. We up dead early on this marvelous Monday. Thank you for bringing the orange. You know, I loving this orange. Keep the morning bright, right?
Indeed.
Perfect. So we're here talking about money, talking about Fidelity's merchant services. So tell us, in terms of money handling and management generally, in what ways has banking changed over the past 5 years?
Well, you know, we got a new emerging customer base. Millennials don't want to come into the bank. They want connectivity. They want ease of doing business. Long gone are the days when you go and use your lunch hour to go to the bank. Now you go to the bank while you're eating your lunch.
Yep.
So you online banking, direct deposits, the list goes on.
That's amazing. I actually, the other day, I found my old bank book, a little paper one, you know, you get in primary school and the plastic sleeve and you flip it open and put in your entry. I was like, yeah.
Watch out now, you're showing your age.
Hey man, I gotta let the people know, man. You know, so that is long gone. And like you said, the digital age is now taking over. So what role has Fidelity played in this evolution in terms of your new initiatives, products, services in the past few years?
Well, you know, again, our digital presence, online banking, direct deposits, and just our presence on Facebook. Persons don't even have to come in to get assistance. They messages on Facebook saying, listen, I need your help. We're here to the rescue. And so you don't have to come into the bank.
Yeah. And that's key, you know, being able to access your money, access financial advice without being there physically. If it's one thing I think that COVID and the pandemic has taught us is to be able to function and adapt to the changing circumstances around us. And this sounds like Fidelity has definitely made it easy for their customers to do so. So your organization is introducing click-to-pay terminals. So tell us, who can benefit significantly from this technology as regards to paying and receiving funds, and what type of businesses will benefit from it?
All types of businesses, from the larger retailers, grocery stores, clothing stores, to the smaller entrepreneurs. Everybody can benefit from this device, from our slew of devices, I would say.
So with regards to the click to pay, how does it work, and what type of services do you do with it?
And so I want to address the click to pay options, because this is not just an option. It's multiple options. So we have physical terminals, and keep in mind our terminals are completely wireless, so on-the-go persons can use it. And again, we have non-card present transaction terminals. Anybody can use these devices, and they're great for anybody on the go or our larger retailers.
Does the click to pay require a special credit or debit card, or is it programmed for Fidelity branded cards or any and all cards?
Not at all. Any Visa, any major Visa or MasterCards, debit or credit cards from any major bank you can use with these devices.
That's awesome. And, you know, right now, you know, money, security, and safety are always at the top of everyone's list, especially when you're paying and receiving money. So what are the advantages of the click-to-pay system over utilizing cash, checks, or any other form of exchange?
So let's take the smaller entrepreneurs, for example. Our young lady who's selling cakes at home, or these young ladies are selling here. A lot of persons online or on Facebook selling goods and services. And let's say a photographer, for instance, he's on the go. He does a wedding. A lot of persons know that he might have cash on him. But if he has one of these devices, let's say, for instance, our bill presentment, where you can send email invoices to persons and just accept the money, go straight into your bank account. You use your debit card again to transact goods or services. And I think that's a wonderful advantage over having cash on you all the time. And again, for our consumers, for the merchants who are doing business with clients, they don't have to travel with cash. Everybody always has their debit card that's connected to their bank account that they get paid on. And so nobody has to travel with cash really when you have these options.
That's definitely makes it more convenient. Like you said, safety is paramount, especially in these days and times. And so you talked about the small business. Let's look at the national picture. So fitting to the orange that Fidelity has been promoting, talking about the orange economy, which is, you know, creative industries, including artisans and entrepreneurs. Do you envision Fidelity's click-to-pay terminals also making a major contribution and enabling more entrepreneurship amongst the orange economy?
Indeed. Again, we talked about smaller entrepreneurs some time ago. The person on the side of the road selling coconut water, to the young lady selling cakes at home, to the photographer. All of those persons can benefit, especially from our option. It's called bill presentment again. And you send email invoices to persons, and let's say the person who makes cakes at home, she comes home from work and she's selling cakes on the side. Someone can call her or WhatsApp her or Facebook message her and say, listen, I need my birthday cake for my son. You send that email invoice to that client, they click and they pay, you collect your cake, that's it. Money goes straight into your bank account.
Money in the bank, cake in your belly, right?
Indeed.
So what would you say, because you talked about millennials. Millennials don't want to go in the bank. They want to be able to access their funds and financial advice on the go. Has there been a learning curve among the older customers or members of your client base?
Well, I would say yes, of course. With any new device, it's always a learning curve. But again, we are here. You can WhatsApp us, you can Facebook messages, and for the older crowd, they can always call us. We're always available 24/7. They can call me and we'll walk them through the process. And of course, we train them as we go along. But, you know, we got to move with the times. The times call for change and accessibility, and this is where we are.
Definitely agree with that, 100%. So as we wrap up, what more can you say to encourage retail merchants, other types of businesses and consumers to adopt and use the click-to-pay system and terminals?
So let me give you an example. During the pandemic, persons had limited amount of time to do anything. Let's talk about you had an hour a day to go to the grocery store or do anything that you needed to do. Persons didn't have time to go to the ATM, but they always had their debit card attached to their savings account that they have money on. Any merchant out there who doesn't have a machine or one of our click-to-pay options is losing cash daily. Anybody that has cash that goes into a grocery store or clothing store, for instance, you have a limited amount of cash on you. But you know, Mark, anytime you go to the food store, you see something here, something there, you see a cookies which you like, but you don't have that much cash on you. You always have your debit card on you. And so again, persons who don't have one of these options are losing money daily.
That sounds like the stamp on it right there, because once you tell people they're losing money, they pay attention. So we're so happy that Fidelity Services and Fidelity Bahamas have introduced the click-to-pay terminals and this service to the country. As we wrap up, how can our viewers, how can your clients and future customers find out more about the click-to-pay services?
Oh, that's easy. We got a number of options. First, you could call me 356-7764, extension 3028. We also have a Facebook presence as well. And that's it.
I said the access is the key. And if you can't find them online, then look around for one of those click-to-pay terminals. And there should be a button on there that you hit, and the Fidelity team comes swooping in right away to give you the assistance you need, right?
Indeed.
I would like to thank Jermaine Wilkinson, Merchant Services Representative with Fidelity Bahamas. Thank you for coming on Bahamas at Sunrise this morning and talking to us about click-to-pay.
Thank you guys for having us.
Yes, thank you very much. You're watching Bahamas at Sunrise. We'll be right back.
One thing, two things, blue thing, old things, things that are small, things that are grand, things that fit just right, and in the palm of your hand. Fox Hill Nursery, a large selection of garden supplies. If you can see it in your mind, you can find it at Fox Hill Nursery.
The sports we play depend on the health we build. So let's stay healthy. Wear a mask and practice social distancing and hand washing to protect yourself and others. Remember, COVID-19 is not a game.
A public service message from the Bahamas Olympic Committee.
Welcome back to Bahamas at Sunrise. May is a time to raise awareness of those living with mental or behavioral health issues and to help reduce the stigma so many experience. Joining us to discuss the importance of Mental Health Awareness Month, we're so happy to welcome Jewel Horton, who is a psychologist. Jewel, good morning and welcome to Bahamas at Sunrise.
Good morning. Good morning. Thank you for having me.
It's a pleasure to have you with us. This conversation is so important, Jewel, and so it's really great that we just get to bring awareness to it. Let's start off by kind of talking about these buzzwords. We've been seeing it a lot more in the media lately, which is a good thing. But what is mental health?
Okay, so when we look at mental health, we normally look at the overall psychological well-being of a person. So which looks at their mental health, their verbal health, their emotional health, and definitely their social emotional development. And all of that looks at, how a person thinks, feels, and acts. So basically mental health, like to sum it up, just looking at a person from a holistic perspective, but then looking at, how they think, they feel, and they act.
Okay, how they think, how they feel, and how they act. And, we can't always tell. Well, I guess some of our body language may give away how we feel sometimes, but lots of us have learned to mask certain behavioral traits, right? And so sometimes I guess some people are shocked when they see certain people do certain things, or even with this idea or notion of suicide, etc., because it doesn't seem to line up with what they've seen on the outside. So it's really important that we go a bit deeper. What are some of the factors that contribute to mental health issues?
That's the thing. So the factors could be so diverse and definitely so complex, because you could have a person who has experienced like adverse child abuse, sexual abuse, physical abuse, social disadvantages like poverty, like long-term stress, a lot of social isolation, loneliness. And also you could have persons who have been affected by mental health from a biological standpoint, because if you have a parent who, let's say, is diagnosed with bipolar, schizophrenia, or any other mental health concerns, you are more likely to be diagnosed once that environmental trigger is activated, quote unquote, to say. So you could have a bunch of different factors that could actually trigger it off. Excuse me.
All right, I'm so sorry. I think I got a little disconnected there, but I think that was a really good answer that you gave. And I think one of the things that we need to understand is the difference between mental health and mental illness, right? So talk to me about that.
Yeah. So, as I said before, mental health looks at, the overall aspect of a person. But when we look at mental illness or mental illness, this is when we start to look at, more of the clinical diagnoses, or, more of, let's say, the mental health conditions and concerns that affects a person's thinking and definitely their behaviors. So not so much looking at how depression affects how somebody thinks, how somebody feels, and how somebody acts. Schizophrenia, bipolar, the neurodevelopmental disorders, compulsive disorders, personality disorders. So where mental health, it basically affects us generally, mental illness not so much is when it's clinically diagnosed, and these conditions or mental health concerns now affect certain things. Because even though everybody may have mental health concerns, but everybody isn't necessarily, let's say, diagnosed with bipolar, depression, schizophrenia, anxiety, even though that we may sometimes have symptoms of it.
Okay. All right. And so I think that that's important to note, right? That there is a difference between that clinical diagnosis versus something that might be temporary or fleeting or able to be managed differently. And so I'm happy that you made that distinction. What physical effects can mental health issues have on people?
Now, physical effects, so it's something in psychology we normally call like physical symptoms, and that's more so much of how the mental health concerns project physically. So that's like your headaches, your migraines, your tensions, your digestive disorders, your chest pains, anything that, manifests itself physically. So if you start to have headaches, like your joint pains, stomach pains, dizziness, or like all of those concerns, and they are manifested physically from like a mental health condition or from a mental concern. And I remember reading this blog like some years ago, and there was this gentleman, and he spoke about him having chest pains, chest concerns. So he was concerned that well, I don't know what this is. This may be my heart. So he went to the doctor, and the doctor did a bunch of testing, and the doctor told him, well, everything is coming back normal, so I don't understand what's going on. So he said that the doctor told him to go see a therapist, to just see if there's anything else, because medically we don't see anything. So he then, had some pushback and was, well, nothing is wrong with me. I'm not quote unquote crazy or anything. But when he went to the psychologist and they actually started to work out, some concerns, he realized that he was suffering from really bad anxiety. And those anxiety was now manifesting physically, where he had lots of chest pains, chest concerns. And once he now got his anxiety more so much under control, for lack of better words, his chest pains and all of those things stopped.
Wow, that's that's revolutionary, right? And I hope that there's somebody watching today that helps, because sometimes you cannot see what is physically wrong. You feel it, right? No doctor's able to diagnose it, but if you're able to speak with someone about the things that you're going through, and it may not look like anything new to you, but so much of it could be repressed. So many of it could just be a constant pounding of a variety of circumstances that it's manifesting in this way. So this is really interesting stuff. What are some indicators that people should be aware of, though, as they consider their mental health, as they consider how they think, how they're acting, how they're feeling? What should they be looking for to make sure that they are aware of for good mental hygiene?
So that could look differently for everybody. So we normally look at, okay, if a person, or like if you are feeling, helpless, alone, or if you are isolating, your thoughts are racing. However, what I normally tell persons, and like what I normally tell clients, are what are some of your warning signs to know that, okay, I'm starting to spiral down. And even though that it can look at, okay, I don't want to be around nobody, I want to be by myself, I'm having all of these feelings, all of these thoughts. However, for somebody else, it may look at, okay, my boundaries are being stepped over. However, I'm just going to go with it. Or I'm looking more so much at my thoughts are racing. I don't understand why. Or, even I'm over empathizing with persons more, and I'm forgetting about myself, or I'm actually neglecting myself. So it's more so much of, what are your warning signs to know that, hey, something isn't right, whether you're noticing that, okay, I'm kind of sort of starting to feel more moody, or, my emotions are pretty much up and down than normal, or, my thoughts are racing, or, I'm lacking, or I'm not doing much in this areas that I used to do, or, I'm letting myself go. But there are many different factors. So definitely what persons normally think about, which is, the feelings of helplessness, hopelessness, the responding with your behavior, but also what are some key things that you realize that, hey, when things aren't going well for me, what do I start to notice? And they could be some of the indicators that, hey, my mental health is definitely taking a turn for the worse.
Awesome. Thanks for giving us that indication. It's so important to have a great understanding and awareness of self, and then to be able to measure everything else, I guess, against what is our standard modus operandi, so that we can know when something might be a little off. All right. How important is it to remove the stigma associated with mental health, and why? I loved earlier when you talked about the fact that the guy said, but I'm not crazy. And I like that we're trying to get away from that, because mental health is so much more than that, right? So why is it important that we remove the stigma associated with this stuff?
I feel like it's very important because mental health isn't tactile. So it's not something that you could touch. You can't say, oh, well, I could touch, let's say you're feeling depressed or you're feeling anxious or anything of that nature. Whereas like if somebody breaks their arm or if they go or like if they go in the hospital, you could see those things and you could touch those things. However, with mental health, I feel like we normally believe that because we can't see it, it's not there and it's not happening, when that's not the truth. And especially like within our culture and like even like within in the Black community, we normally say, well, ain't nothing wrong with you, you have a roof over your head, you have food, like there's nothing wrong, pray, go to your bed, or just go in the sea, or drink some ginger ale or anything of that nature. However, it doesn't necessarily help those persons, and it makes them feel that what I'm going through, well, maybe it isn't as diverse. Well, I wouldn't say diverse, but it like it doesn't raise so much concerns when you don't have to necessarily go through a lot of trauma or anything to have mental health concerns. So I feel like it's very important to start to break that stigma and also start to recognize it. So even a person saying that, well, I'm completely stressed, just say like it's with work, but how like create open spaces and create safe spaces for persons to talk about it. And just because we can't see it or like we can't touch it, like that doesn't mean that it's not there.
Yeah. Well, I love that you mentioned safe spaces to talk about it. Where can people go if they want to receive help?
So people could go like to a number of different places. So for example, let's say like with youths and adolescents, they go to their guidance counselors and also to the school psychological services unit at the Ministry of Education. You also have the Crisis Center, you have CCAC, you have the BASRA Association, which is the Bahamas Association for Sexual Health and Rights. You have a lot of different private entities like Helping Hands Intervention Center. You have, let's say, you have also like a bunch of different therapists as well that do things, not only privately, but then also pro bono. But you have like a lot of different places where people could go, and even the Bahamas Kidney Association. And I know like when I say that, persons normally be like, go there for mental health. However, a lot of different associations, what I'm noticing now is they're starting to connect with different mental health professionals. So with the Bahamas Kidney Association, what they do, and I was a part of it, they actually have group therapies for persons who were recently diagnosed or, who have family members that, were diagnosed or who are actually living with it. So just creating and providing a safe space for them. So there are many different organizations, private entities. So it's just more so much now for people to reach out to those places.
Excellent. Well, this has been a great conversation. Thank you so much for joining us today. Of course, we've been talking with Jewel Fortin, who's a psychologist, and she's just been giving us some great tips on, noticing the difference between mental health and mental illness, making sure that you're measuring yourself to see when you're doing certain behaviors that might indicate that you're not in the best space, looking out for those things that could appear in the physical. If they can't be diagnosed medically, then maybe considering, seeing someone to talk to, and of course, providing us some great resources on who we should speak to. Jewel, thanks so much for joining us this morning on Bahamas at Sunrise.
Thank you so much for having me.
You're watching Bahamas at Sunrise. We'll be right back. Well, that's going to do it for us, folks. Thank you so much for tuning in to today's episode of Bahamas at Sunrise. We hope you enjoyed it as much as we enjoyed bringing it to you. Make it a great week.
Make it a great week. Thanks for starting out your week with us as always. And get ready because this holiday weekend is coming up, man. And I hope we can get to the beach, Godfrey. I can talk to you on Friday. I'll enjoy your week.
Bye.
Excellent.